I mean, just normal 30-year-olds that,
Medical issues?
no medical issues, none whatsoever.
The COVID-19 crisis surging.
It doesn't discriminate. Everyone is a target, both young and old, healthy and unhealthy.
I mean, it's real. I wish people understood that.
The coronavirus can spread anywhere.
He didn't have to die. Sorry. He didn't have to die.
Not even long-term care facilities are spared. People are tired of living in a COVID-19 world, but
The biggest thing is that, once you can't let your guard down, especially on this.
Anybody that you care about, anybody that you love, if you don't do just the simplest things, you are putting them in danger. Whether you've had it or not, it's not rocket science.
The stories of those who have recovered from COVID-19, those who have lost loved ones to the deadly virus, and the healthcare workers trying hard to protect you. Their united message you have to hear.
we go inside Indiana's COVID crisis. Welcome in to this WRTV special, Inside the COVID Crisis. I'm Mark Mullins.
And I'm Amanda Starantino. COVID-19 cases and deaths are surging, and healthcare experts have warned us to abandon in-person get-togethers and celebrations with extended family and friends during the holidays. Hospitals are filling up, and doctors are worried about the possibility of what's being called a twindemic when COVID-19 intersects with flu season, which could put further stress on hospitals and other healthcare facilities. There is hope, with at least a pair of COVID-19 vaccines already proving to be effective in preventing the deadly virus. But it could take time for those vaccines to get to a majority of the general population. And here's why the race for a vaccine is so important to Americans, especially Hoosiers. Take a look at this map of statewide deaths by day from the Indiana Department of Health. As you can see, deaths in Indiana are surging once again after we saw a significant dip in May, June, July, August, and part of September. Really, from October on, deaths have steadily increased in the state.
As a result, as we wait on the mass distribution of a vaccine, we are all being asked to wear masks and socially distance ourselves. And that's why you never see Amanda and I within 6 feet of each other in this studio. And it's not just deaths. Positive coronavirus cases in general are exploding among all age groups. You see, this isn't a virus only impacting the elderly or people who have pre-existing health conditions. We begin with the story of 30-year-old Charles Fields. With the help of IU Health in Indianapolis, Fields had to battle through a harrowing journey when he was diagnosed with coronavirus. He shares the frightening situation he had to go through and shows you what it's like to recover from COVID-19.
I just turned 30 before I got it. It was a week after. I was always outside fishing, walking. I always went to the gym. I mean, just normal 30-year-olds that, no medical issues, none whatsoever. It started off with just the simple, I was stuffy nose. That's all it was. And then as the days went by, my fever got higher. And then it got up to 104. So I got nervous about it, so I went to the emergency room. I didn't think I had the virus or anything, but I just thought it was just a real bad sinus infection or something. And then they took an x-ray of my lungs, seeing that there was stuff in there, but I don't think they didn't test me or anything. So, but really it was just, I couldn't sleep, and just the fever was the main thing. Well, the next day after I went to our town's emergency room. That night just got worse. I just noticed I was just so fatigued. That's what I felt after that day. And I was telling my girlfriend, it was just something ain't right. So she's like, well, we'll just take you to Bloomington. And then while we were going to Bloomington, that's when my shortness of breath started happening. So I knew something was going on, obviously. And then that's when they found out I had double pneumonia too. So, and then I remember the 2 days, they finally got my fever down. And then I felt great that one day. And then that night, it's like everything just went south. My breathing just cut off. I remember when I went to the ICU in Bloomington, they put a CPAP machine on me, and then they were saying, we're going to administer you some medication. And then it felt like maybe 10 minutes later, I was out. And then I woke up here. So 18 days later, I woke up here. Of course, I'm still fatigued, and my mind's all cloudy, and I kind of was wondering if I was ever actually going to get out, because I didn't know. I don't know, it was just lonely, because none of your family's there or anything. Life's short. You just don't know when it's what will happen. I didn't think that me just turning 30, I'd go down the road I just did. I mean, just take precautions. Yeah, you may not see it, or you may see just videos of it or whatever, but I mean, it's real. I wish people understood that, but not to live life in fear. I mean, I'm not trying to live my life in fear. I'm trying to go out and do what I used to do, but I take all the precautions I need to take.
COVID-19 has had a devastating impact on people who live and work in nursing homes. More than half of the state's deaths have come from long-term care facilities, and some are concerned about the impact this winter will have. WRTV Investigates Kara Kenny found some families who lost loved ones, as they're left wishing more could have been done to protect them from the virus.
More than 2,500 nursing home residents across the state of Indiana have died from COVID-19, including 18 here at Ben-Hur. These are the numbers from the state's database, but each one represents a loved one that a family member will no longer talk to.
This is the last thing that I make for my mom. I wanted her to have something beautiful and special for her at her funeral.
Mary Johnson has a little piece of her mom at home. Martha McCullough died May 16th at the age of 77 after developing COVID-19 at Ben-Hur, a nursing home and rehab facility in Crawfordsville. How much do you miss your mom?
Very much. It's rough. I promised my dad I'd take care of her before he passed away, and he just passed away in 2019. And then they closed us down, and I couldn't get in.
Nursing homes were closed to visitors during the early months of the pandemic. Mary was able to say goodbye to her mom in person at the hospital 2 days before she died.
It's a memory I'll have forever. She took her hand and she grabbed mine and she pulled it down to here and took her other hand and wrapped it around me. She knew I was there, and it's the first time from March.
Janice Ford didn't get that chance. She had to say goodbye to her brother Charles England over the phone as he lay dying at the hospital from COVID-19.
He told me he loved me, but it was almost, so light that I couldn't hardly hear him. He was so weak by that point.
Charles England also got COVID-19 at Ben-Hur and died May 22nd.
It's hard to know that he didn't have to die. Sorry. He didn't have to die.
Janice and Mary feel the nursing home didn't have adequate infection control procedures in place at the time. The Indiana Healthcare Association, which represents many Indiana nursing homes, says in the spring, facilities were not well equipped with N95 masks and other supplies.
I think what we're going to see is a lot of the tragic loss of life that occurred early on in the pandemic. And that was when the country was caught somewhat flat-footed, and prioritization of PPE and testing just wasn't with long-term care at that point.
It wasn't until July that the state started testing all nursing home workers for COVID-19. In August, the federal government sent antigen testing machines to Indiana nursing homes, allowing them to do frequent testing of residents and workers. And it wasn't until November the state sent in the National Guard to help nursing homes plagued with understaffing. Transparency was a problem too. For months at the start of the pandemic, WRTV Investigates requested data showing where people were dying in nursing homes, but the state told us no.
We don't have a cumulative list of every facility, all of their cases, and all of their deaths.
It wasn't until July they changed their mind.
We are going to report facility-specific COVID-19 data.
AARP Indiana was one of the groups that pushed hard for the state to release nursing home COVID-19 data broken down by facility. Information scarce at the start of the pandemic is now readily available on the state's website.
Definitely encouraged that we got there eventually. That definitely empowers folks to be able to look at the data themselves and help them make decisions.
AARP Indiana State Director Sarah Waddle is concerned about the impact winter will have on nursing homes.
There hasn't really been a comprehensive plan from the state to address virtual visitation, which is going to be absolutely needed.